Hello, welcome to the 2020-2021 academic year Illinois College Immunization Requirements video for Eastern Illinois University. I'm Eric Davidson, Interim Director for Health and Counseling Services, the department which oversees and maintains compliance with the Illinois College Immunization Act. The Illinois College Immunization Act is a state law that requires residential campuses to collect proof of immunity from students for certain infectious diseases. Again, this law only applies to those campuses with residential hall systems. If you are transferring from a community college, or if you've previously attended a community college, you more than likely were not required to submit immunization records to that institution because Illinois law prevents and forbids community college systems from having residential systems. The Illinois College Immunization Act applies to students born on or after January 1st, 1957. At Eastern Illinois University, we apply this requirement to students during the first semester a student is enrolled in 6 or more hours of coursework in a classroom environment. We define this as basically saying the first time a student takes 6 or more hours of on-campus coursework, they're required to abide by this particular act. Sometimes it's common for us to have students who have been working toward a degree on a part-time basis and maybe only taking 2, 3, 4, or 5 hours during a semester. And after having been enrolled at the institution for several semesters, finally surpass this 6 or more hours and then are required to submit immunizations. Students who have also been registered previously for 6 or more hours, who have been away from the university for over a year, are also required to submit records. Students who may not have yet met the 6 or more hours of coursework are not required to submit records, but are highly encouraged to do so. The Illinois College Immunization Act requires a series of certain immunizations. One of the series centers on measles, mumps, and rubella. 2 series of these vaccinations must be received on or after one's first birthday. A second series focuses on diphtheria, tetanus, and pertussis containing vaccine. Students must show documentation of having 3 dosages of this vaccine. Of those 3 doses, 1 must be a Tdap vaccine, and the last dose of vaccine has to have been administered within the last 10 years. A third immunization which is required focuses on meningitis A, C, Y, and W135. A, C, Y, and W135 focuses on different strains of meningitis. Students who are 21 or younger are required to show proof that they've had vaccine administered on or after their 16th birthday. And again, this vaccine must cover A, C, Y, and W135. Within the past few years, vaccine covering meningitis B has been released to the market. That vaccine is recommended, but not yet required by the state of Illinois. Domestic students may submit immunization records using a wide variety of forms. An immunization form is available through the EIU Health and Counseling Services Medical Clinic website, but we find that many students will also submit records using high school immunization records, college immunization records if they're transferring from another institution, and for those individuals that are currently serving in the military or are veterans, frequently will use military immunization records. We will typically accept most records and forms, but it is key and important to remember that those records must be signed and dated by a medical professional. That signature and that date verifies the authenticity of the records and allows us to know that these records are truthful and the immunizations have been administered correctly. Students may submit records by a variety of ways. We will accept records by fax, as PDFs sent through email, through snail mail sent to our mail account, as well as in person for those who wish to deliver their immunization records by hand. Occasionally, we will have families send immunization records to other departments, such as admissions or new student orientation or athletics or an academic program. Often our colleagues are really great about forwarding records to us, but there have been times where those records have not reached us. So we ask that you do not rely on other departments to forward immunization records to us. Please make sure that they're sent to us directly. For international students must submit official records using the World Health Organization International Certificate of Vaccination. And instead of sending records in, we will collect vaccination records during the international student orientation process. We strongly encourage you to submit your immunization records as soon as possible. For those students whose first semester would be the fall semester, we strongly encourage you to submit them to us by August 1st. For those students whose first semester falls during the spring semester, we strongly encourage you to submit records by December 15th. And for those attending summer for the first time classes, to submit records to us by May 1st. The earlier you get your records into us, the earlier that we can review them, determine if they meet the requirements set by the Illinois College Immunization Act, and if for some reason they do not meet the requirements, it provides us with plenty of time to notify you of that, to allow you plenty of time to make sure that you take action to correct and rectify the records which do not meet verification. For those students who do not meet verification by the 10th day of class, we will put an administrative hold on that student's university records on their accounts, and that will prevent them from being able to register for classes in the future. If verification still has not been, if records have not been verified 30 days after the first day of class, we will also put on a $35 non-compliance charge. Within the past few years, Eastern Illinois University has been encouraging new students and families to utilize the My EIU system, a checklist of items and tasks that new and incoming students should complete prior to coming to campus or immediately upon arrival. Often we will get calls from families asking why, after having submitted immunizations, My EIU has not turned green yet. There are several reasons for this. First, a student must have been registered for classes. If a student has not yet registered for classes, immunizations may have been sent, but the bridge between our electronic medical record and My EIU has not been activated. It only becomes activated once a student has registered for classes. Also, in order for the My EIU immunization tab to turn from red to green, the immunizations must have been received. They must have been manually reviewed. After being reviewed, they have to be verified as meeting the regulations of the Illinois College Immunization Act. And then once we have verified them, they have to be entered into the EMR, and then the EMR has to synchronize with the EIU banner system. This is not a quick process, especially with the great number of IMs that we receive, particularly before the beginning of school. So we ask for your patience and understanding, knowing that you have sent immunization records into us. It may not be at a point where everything in our process has been completed to allow the record to turn from red to green. If records do not meet the regulation requirements, we will make contact with the student via EIU email, campus mail, or the U.S. Postal Service. Typically, we will contact students if the records do not meet the regulation requirements, and then occasionally we will make contact with students if we have not yet received any records that have been submitted or verified. We will usually make occasional notice prior to the start of the semester, but once the semester starts, we will start reaching out to those students who have not submitted records to us yet. For those that do not have immunizations or need immunizations for compliance, we do offer those through our medical clinic. You will find the ones that we offer and the cost on the slide currently. The medical clinic does not accept third-party insurance. We do not bill third-party insurance, so you may find it more cost-effective to use your primary insurance and get these vaccinations at home before you come to campus, or if you've already arrived on campus, you may seek immunizations from local off-campus sources such as the Charleston CVS, the Charleston Walgreens, the Charleston Walmart, as well as possibly the Coles County Health Department. In addition to the medical clinic, if you have questions regarding mental health services and counseling, that phone number, that website, and that location is noted on this slide. If you have questions about our student insurance program and how it may work with your primary insurance program, or if you do not have primary insurance, how it may help provide some coverage, we would encourage you to call the phone number listed here, as well as go to the website to learn more about our student insurance program. Thank you for taking time to view this video on immunizations. We hope that you check out Health and Counseling Services, and thank you for helping us maintain a healthy campus community.